Have you heard of the vagus nerve? It is one of the most popular and the most complicated of the 12 cranial nerves. It plays a critical role in regulating many vital organs, mostly in the chest and abdomen. But without a properly functioning vagus nerve, your digestion, your respiration, your heart rate, and your emotions can all suffer. Perhaps that's why optimizing the vagal nerve function is so popular in integrative medicine. I'm Dr. Sarah. Today I want to discuss with you the vagus nerve, what it is, what it does, some of its major functions, signs when it's not functioning optimally, the vagal response triggers, measuring your vagal tone using heart rate variability, and ways to balance your vagal tone using holistic practices, lifestyle practices, and nutrition. So let's get started. The vagus nerve. All right, it's the 10th cranial nerve, as I already mentioned. It is the most complex and the longest of the 12 cranial nerves. It's predominantly the parasympathetic division of the autonomic nervous system. Okay, so there are two major divisions of the autonomic nervous system. Sometimes there's people say three because there's a whole nervous system in our gut, the enteric nervous system. But the parasympathetic nervous system is the division of the autonomic nervous system, which means it's under involuntary control, it's subconscious. That actually is the calming aspect. It's what they say as the rest and digest part of the autonomic nervous system. Now, the sympathetic nervous system, or the SNS, is what helps prepare the body for an emergency. It's been deemed as the fight or flight part of the nervous system. The left and the right vagus nerves, which are collectively known as the vagus nerve, but technically there's really two branches. They contain 75% of the parasympathetic nervous system nerve fibers. So that is a lot. So this is why the vagus nerve is often attributed to the calming response in the body. But it's important to remember that it is a mixed nerve. It carries both sensory and motor fibers with some sympathetic influence. So it carries motor and sensory information to the organs that it innervates and carries the sensory information back to the central nervous system to process and to make a judgment about what's it going to do as far as the function of the organ that it's innervating. So you can think of your vagus nerve as this vagrant, and that's where it got its name, which means wandering nerve, that expands all the way from your brainstem, which specifically in the medulla oblongata, that's where a lot of the subconscious body functions are regulated or stem from. And then all of these different branches that come down from all the way through the chest, through the abdomen, and it innervates all of those different organ systems. So it has connections from your neck to your chest, to your heart, to your lungs, to your abdomen. Hopefully most people just have one abdomen. And its fibers communicate information from the brain, the heart, and the digestive system. So this means what it does is it influences your blood vessels, your cardiovascular system, your gut, your liver, your digestive and respiratory functions. And because it innervates the skull, it also plays a role in sensory processes such as hearing. It also has critical tasks, including regulating heart rate, blood pressure, breathing, and digestion, which we kind of already talked about under functions. Now, those are some of the basic functions, but some of the other ones are immune system response, inflammatory response, including this is through the way that it interacts with the hypothalamic pituitary axis, right? The parts of your brain. It'll send signals back and forth and communicate with that. And that can send an inflammatory response through your gut, through the enteric nervous system. The little microbes in our bellies actually communicate and send metabolites as they process our food and the environment and communicate through the vagal nerve to the central nervous system and brain. And the vagus nerve also regulates our mood, our mucus and saliva production, our skin and muscle sensations, our speech, our taste, our urine output, reflex actions such as coughing, sneezing, swallowing, gagging, vomiting even. And this is through its skin and muscle sensory innervation. So if you have seen a functional medicine practitioner or an integrative practitioner, sometimes they might have you do strange exercises for vagal nerve tone, and that includes things like initiating a gagging response, or even singing, or things related to speech. They also, the vagus nerve is also related to communication between the gut and the brain, and that's kind of what I talked about with the inflammatory process. So that is the vagus nerve, what it does in some of its functions. Now, let's look at what triggers the vagal response. So a stimulation of the vagus nerve that can lead to symptoms, in other words, when the vagus nerve gets a little bit dysregulated, are stress, fear, gastrointestinal disorders, right? So if there's problems in the gut, sometimes that can cause an imbalance in the vagus nerve related to the enteric nervous system. Having an actual bowel movement can cause a vagal response. Some people notice they'll get dizzy or they'll get symptoms with a vagus, and that's because of the way the bowels are innervated in your digestion with the vagus nerve. Sometimes just the sight of seeing blood or getting your blood drawn, that can cause the autonomic nervous system to become dysregulated, especially if you're fearful of needles or blood. Changes in position, because there are regulators or baroreceptors, not baroreceptors, but different receptors in our body that actually regulate our position. Specifically, there's some in the ears that will modulate the position that we're in, and that can cause somebody's vagus nerve to be triggered. Heat, pain, and trauma are some other ones. Now, how will you know if there's a dysfunction? Some of the signs of actual vagal dysfunction is related to vagal nerve damage, and it is also referred to as an autonomic dysfunction or dysautonomia. So some of the symptoms could be digestive issues. People that have problems swallowing, it's known as dysphagia. Acid reflux can be a vagal dysfunction or a nerve issue. Gastroparesis, where the food isn't effectively moving through the intestines correctly. When someone faints due to a sudden drop in blood pressure because they're scared, that's called a vasovagal syncope. And I want to just kind of pedal back a little bit too. It isn't necessarily that the vagus nerve is damaged with vagal dysfunction, but it can lead to damage of the vagus nerve, and some of these symptoms can occur. But there could just be an imbalance. Orthostatic hypotension is dizziness or fainting from a drop in blood pressure when you change positions. So in other words, again, there's that regulation. The blood vessels are not, the circulation isn't bringing enough blood back up to change the blood pressure, so someone can go from sitting or standing to sitting without getting dizzy in their head or other parts of the body, causing other parts of the body to be in alarm. And then laryngeal issues, which can affect the voice, are also related to vagal dysfunction. Now, what about vagal tone, which is a term that refers to how well the vagus nerve is functioning? So we talked about vagal dysfunction. Vagal tone occurs without damage to the nerve, and it's based on some of the triggers we talked about, right? Like the fear, all of the different function or various triggers, gastrointestinal disorders, heat, pain, trauma. Now, symptoms can include, when there's some low vagal tone, anxiety, depression, poor emotional regulation, high stress response, being in fight or flight mode, lowered attention span, increased inflammation and pain. That can all be signals that your vagal tone is off. And if you think about it, when you're stressed, right, that triggers a whole lot of different physiological and psychological issues. And the vagus nerve is one of those pathways. Low vagal tone is also associated with other conditions. Now, this is low vagal tone, not damage, and these include gastrointestinal problems such as IBS and Crohn's, neurological conditions such as Parkinson's, depression, anxiety, PTSD, metabolic disorders such as type 2 diabetes and cardiovascular diseases, hypertension, irregular heartbeat such as atrial fibrillation, which is a really fast heart rate, and this is measured by heart rate variability when you measure vagal tone. Now, what is heart rate variability? So heart rate variability measures the amount of time between heart beats caused by variations between the sympathetic nervous system and the parasympathetic nervous system, right? So it's that pumping action, the relaxation, the pumping action, the relaxation. It provides more insight into the functioning of the autonomic nervous system, including how it regulates blood pressure, gas exchange, gut function, heart rate, vascular tone, and even facial muscles, right? So according to an article in Frontiers in Public Health, optimal levels of heart rate variability are associated with health and self-regulatory capacity and adaptability and resilience. And higher levels of resting vagal mediated heart rate variability are linked to performance of executive function like attention and emotional processing by one of my favorite areas in the brain, the prefrontal cortex. So in other words, the information from the heart also impacts the brain. And there's also, this is another topic for another day, but they use heart rate variability to measure heart coherence, which is the relationship between the communication between the heart and the brain. And also this influences how well we think, how we process things, and how resilient our bodies are. A lot of fitness people will use heart rate variability to see their nervous system tone for the day and how hard they should work out, or if they're adequately have rested and, they don't want to overtrain. Now, it's important to know there isn't a normal heart rate variability. It's more related to your variance, and that's the most important thing. It's probably more accurate to say that heart rate variability actually predicts cardiac vagal tone, but again, that influences everything else, so you get an idea. So we talked about vagal tone, we even talked about measuring it, we talked about conditions associated with it, some symptoms when vagal tone was low. We talked about vagal dysfunction when there's actual nerve issues or getting to the point where there's nerve damage. We talked about some of the triggers. We talked about the vagus nerve's functions and what it does. I hope you're feeling super smart about the vagus nerve right now. And now we're going to talk about ways to improve vagal tone if you kind of feel like you're getting some of these symptoms, or just that you want to optimize your health and your resiliency by tonifying your vagus nerve. So things such as stress reduction, nutrition, and exercise always have a place to modulate the nervous system. Nutrition, especially through the brain-gut axis, right? The communication from the gut to the brain by the vagus nerve is important. And some foods high in B vitamins, high in magnesium, and foods that feed the microbiome, like fermented foods and polyphenol-containing foods, those what kind of you think of as your antioxidant foods, your plant foods, those are good for your microbiome. Magnesium, one of my favorite ones, is dark chocolate. And also just your fruits and veggies and your whole organic. Most people will do gluten-free grains for their B vitamins. Now, techniques and interventions that have also been shown to modulate heart rate variability in human studies indicating better vagal tone were reviewed in an article I found that will be linked in the video description. And again, all the resources and references will be linked in the video description, because I actually wrote an article to accompany this video that has all of this info for you. But some of the things that was mentioned in this article and some of the studies that showed better heart rate variability, including interventions with fish intake and specifically omega-3 fatty acid supplementation, probiotics, breathing techniques, chanting, laughter, positive emotions, and social connections. There's this whole aspect of the vagus nerve that when it feels safe, it is more mediated, right? Your fight and flight is down and you're better able to rest and digest, and social connections that are safe help you do that. Mindfulness, practicing forgiveness was actually in a study for enhancing heart rate variability. Again, we talked about exercise, aerobic, stretching, resistance training, and yoga were all mentioned. Music therapy, massage, gag reflex stimulation, cold water facial immersion, sleeping on the right side. This was interesting. According to the review, one study with subjects with coronary artery disease showed that their highest parasympathetic tone was followed with 5 minutes of lying on the right side versus upright. And then I added essential oils because essential oils can modulate the stress response and vagal tone. Some of them have been shown to influence heart rate variability. I will be following up with that most likely in another blog or video, so stay tuned for that. All right, so we've covered a lot about the vagus nerve, and you can see why it's so popular in integrative medicine. There's a good reason for that. It impacts all vital functions in the body and regulates our psychology. Now, the good thing is we can indirectly assess our vagal tone by heart rate variability and the symptoms we're experiencing, and then modulate that with some lifestyle practices such as diet, movement, mindfulness, social connection, music therapy. And all of these things can optimize our vagal tone and enhance our resilience. So I would love to hear from you about if this helped you understand your vagus nerve more, and if you have more appreciation for all this that this 10th cranial nerve does for our body and for our mind. And please place your comments in the video description. I read all comments, I respond personally. I'd also like to hear any feedback if you've tried any of these vagal nerve interventions and what your experience was. And please stay tuned for more videos. And especially if you haven't yet, please subscribe to my newsletter because I have some exciting news coming out within the next few weeks. And I don't want you to miss it because it won't necessarily be on YouTube. I will be posting some announcements on YouTube, but more of the information will be found within my community in my newsletter. I also have other free resources, and I offer classes and other things that you can look into that will optimize your health, wellness, and knowledge of essential oils on my website. So be sure to check that out in the video description, like the video and share it. That helps keep these videos free and the information out there for people who want it and who want to improve and optimize their health. All right, enough of that. Have a wonderful rest of your day or evening whenever you're watching, and I will be back. Take good care.